Hi, my name is Danielle Henry,
Nessa Torres,
and Sarah Withers.
and we're here to talk to you today about chemicals that can be found in your home that can poison your pets. Preparedness is key. It's important to know the contact information for your poison control hotline, as well as the closest emergency clinic in your area. Always try to keep a poison kit handy in your house, and always bring a sample of suspected toxins to your veterinarian.
Here's a list of chemical toxins that we will be discussing today.
Antifreeze is a 95% ethylene glycol-based fluid added to water to lower the freezing point. It is mainly used in the radiator of motor vehicles. It is also one of the most common forms of poisoning in small animals, which causes ethylene glycol toxicosis when ingested. Antifreeze poisoning affects the brain, liver, and kidneys. As little as a tablespoon can result in severe acute kidney failure in dogs, while as little as 1 teaspoon can be fatal to cats. Symptoms of antifreeze poisoning include lethargy, depression, nausea, vomiting, diarrhea, rapid heartbeat, panting, excessive thirst and/or urination, uncoordinated movements, and/or drunken behavior. Signs may develop 30 minutes to 12 hours later, depending on the amount ingested. Your pet can come in contact with antifreeze if it drips from a car's radiator or if there's spills, where it can be licked off the ground and ingested by your pet. If your pet has ingested antifreeze, you should immediately rush your pet to the veterinary facility. Call beforehand if possible and let them know that you are on your way. This can help the veterinary team prepare for your arrival. Veterinarians should conduct a complete blood profile, including a chemical blood profile and a urinalysis. Your veterinarian will want to test the vomit or stool if possible. The antidote for antifreeze poisoning is flumpyazole, which is also known as 4-MP. Aggressive therapy is necessary to survive. Your dog may need to be held in intensive care to prevent kidney failure. A way to prevent your pet from coming in contact with antifreeze is to keep antifreeze containers tightly closed and stored out of the reach of your pet. Take care not to spill, and if it is spilled, ensure that it is immediately cleaned. Don't allow your dog to wander around unattended where there is access to antifreeze. The U.S. Food and Drug Administration has labeled propylene glycol safe, and it is now used for antifreeze. Look for antifreeze with this ingredient instead to keep your pet safer from accidental poisoning. When a battery is punctured or swallowed, there is risk for alkaline or acidic material to leak out, resulting in corrosive injury. The most common types of batteries ingested or chewed on by dogs are alkaline dry cell batteries or button/disc batteries. Exposure to an alkaline material causes little to no pain initially, thus, patients are not discouraged from accidental exposure. If the battery remains in the stomach long enough for the casing to break down, heavy metals such as zinc or lead may be released and lead to toxicosis. It may also pose a foreign body obstruction threat. Symptoms of battery ingestion include drooling, irritation of the tongue or mouth, oral pain, dysphagia, hypothermia, vomiting, lack of defecation, abdominal pain, melena, pawing at the face, and anorexia. If your pet has ingested a battery, take your pet to the veterinarian as soon as possible. If instructed by the veterinarian or the pet poison hotline, you can administer substances such as milk or water by mouth to dilute and protect the stomach from toxins. Your veterinarian may administer bulking agents such as wheat bread, psyllium, or canned pumpkin, which may be helpful in moving small button batteries or battery pieces through the GI tract. They may also administer sulfoxafate to patients that develop mucosal irritation or ulcerations, in addition to giving an H2 blocker or a proton pump inhibitor. Patients with ulcerations may also be given a broad-spectrum antibiotic to combat secondary infection. Keep all batteries stored up and away from pets. You can put them in locked cabinets, closed desk drawers, or tall shelves where it's safe to store these products. Dispose of the batteries properly as well. Organophosphate is a chemical which inhibits cholinesterase and acetylcholinesterase, which are essential enzymes in the body. Organophosphate is also a common ingredient found in Raid pesticide products. Symptoms of organophosphate toxicity include vomiting, diarrhea, fever, anorexia, depression, seizure, muscle tremors, respiratory failure, and constricted pupils and hyperventilation. If your pet has organophosphate toxicity, take your pet to the veterinarian immediately. Your veterinarian may induce vomiting, perform a lavage, and then give your pet activated charcoal to detoxify and neutralize any remaining pesticide. To prevent organophosphate toxicity, read your labels. If you are to spray pesticides such as Raid, vacate and let the area dry. Give it some air. Hide and don't seek. Be smart about storing. There are 4 prime hiding places, which include under or behind sinks and appliances, in hidden cracks or crevices, under or behind furniture, and in child-proof cabinets or pantries.
Hi, my name is Sarah Withers, and I'm going to be going over the next few chemical toxins with you. The next one we're going to talk about is carbon monoxide. It's also known as the silent killer. So what is carbon monoxide? Carbon monoxide is a colorless, odorless gas produced by the combustion of carbon fuels. And it's going to affect your pet by preventing their body from being able to absorb and use oxygen. And it does this because carbon monoxide is more attracted to the oxygen that they're breathing in than the hemoglobin is in their red blood cells. So it's going to use up all the oxygen before their body can. Most often your pets are going to come into contact with this gas by being exposed to it in the form of car exhaust, furnaces, gas water heaters, kerosene heaters, smoke inhalation during building fires, and even airplane cargo holds if you're traveling with your pet. Some of the most common symptoms you're going to see with toxicity is going to be lethargy, drowsiness, depression, nausea, neurologic symptoms, difficulty breathing, brick red gums, and if left untreated, eventually it will kill the pet. Now, what should you do if you think your pet has carbon monoxide poisoning? Well, the first and the most important step is going to be to move the pet and any other animals or humans to a well-ventilated area. Carbon monoxide is highly toxic to humans as well as animals, so if any humans in the household are exhibiting symptoms of carbon monoxide poisoning, 911 should be called immediately. We're not going to be a whole lot of help to our pets if we're also succumbing to the effects of carbon monoxide. And now the overarching theme of this whole presentation is prevention. So how can we prevent carbon monoxide poisoning? Well, we can house pets in well-ventilated areas away from cars, furnaces, and heaters. And there are actually carbon monoxide detection devices that are relatively inexpensive and can be installed in your home. And these can alert you to an emergency before it's too late. All right. The next chemical toxin we're going to discuss is going to be methanol. Now, methanol is a highly toxic alcohol found most commonly in windshield wiper fluid. However, it's also seen in a lot of similar products. It's going to have multi-systemic effects on your pet, meaning its symptoms are going to be very variable, but the most notable of which is going to be central nervous system depression. Now, this may seem kind of like an oddball on our list of chemicals today, one you may not have thought of before, but it's common in almost every household and is often stored inappropriately. Pets are most commonly going to come in contact with this by licking up spilled windshield wiper fluid or chewing on product containers that haven't been stored properly. Symptoms are going to include vomiting, a drunken, wobbly gait, blindness, hypoglycemia or low blood sugar, cardiopulmonary arrest, coma, and eventual death. Now, what should you do if you think your pet has ingested windshield wiper fluid? Well, the first thing you want to do is take the pet to a veterinarian immediately for treatment. It's also a good idea to call the veterinary clinic ahead of time so that the team can prepare for your arrival. Sometimes when a pet ingests a toxin or a poison, the pet poison hotline or your veterinary team may recommend that you induce vomiting to get rid of some of that poison. However, with methanol, that is not the case. Methanol is highly caustic and can cause severe damage to the esophagus or lungs if it's vomited up. You can give milk or water by mouth to dilute the toxin and protect the stomach. However, if you're going to do this, it's incredibly important to make sure that the pet is aware, awake, and able to swallow to reduce the risk of choking or aspiration. Now, how can we prevent methanol toxicity? First, we should properly store all products containing methanol up and away from pets. We should never store windshield wiper fluid or other similar products in anything other than the original packaging. Now, why is that important? It's important because in an emergency situation where you suspect your pet may have ingested one of these chemicals, it can make identification of the product and those toxic ingredients very difficult if we don't have the original packaging. Alright guys, the last chemical toxin that I'm going to be talking to you about today is going to be rat poison. Now, even before seeing this presentation, I'm sure we could all agree that rat poison is dangerous to your pet. So why are we talking about it today? Well, rat poisons are designed to look and taste appealing to animals. So this is a very commonly seen emergency in the veterinary world. There are many different types of rodenticides, and if you have to keep these products in your home, it's important that you be familiar with the active ingredients and the associated signs of toxicity. Now, how are they going to affect your pet? Well, the symptoms of rodenticide poisoning are variable depending on which type of rodenticide the pet has consumed. Now, at the top of the page, I have listed 4 of the most common rodenticides on the market right now. So, for example, bromethalin causes swelling of the brain. Phosphides release deadly phosphide gas into the GI tract. Anticoagulants are going to cause systemic bleeding in your pet. And cholecalciferol will eventually cause acute kidney failure. So, although symptoms are variable among the different rodenticides, there are some commonly seen symptoms, and I've listed them below for you. These are going to include drooling, increased thirst and urination, nausea, vomiting, abdominal pain and bloat, halitosis, diarrhea, shock, seizures, paralysis, and death. Now, what should you do if you think your pet has rodenticide poisoning? Just like with all of the other chemical toxins we've been discussing today, we need to get the pet to a veterinarian as soon as possible for treatment. Now, in these pets, we do not want to induce vomiting. Now, the reason is a little different than what we previously discussed with products like methanol, and is more specific to phosphide rat poisons. Now, these products work by releasing a deadly phosphide gas, which is produced when the poison mixes with stomach acid. If a pet who has ingested phosphide poisoning vomits in an area that is not well ventilated, it could potentially poison other pets or humans in the area. Next, we need to bring in the packaging and a sample of the rat poison so that it can be properly identified. If the chemical is not easily identifiable on the container or packaging, look for an EPA registration number. This can be used to identify it as well. And then most importantly, how can we prevent rodenticide poisoning? First, proper storage of all poison and bait products in areas that are inaccessible to pets. Products that come with bait boxes or plastic housing to make the poison inaccessible to larger animals are ideal. However, it's important to remember that these are not fail-proof and are still accessible to a dog or a cat who really wants to get at it. And then lastly, know what chemicals are in the products you buy. If all of our prevention methods fail, knowing what poison your pet has been exposed to can be the difference between life and death in an emergency situation.
Strychnine is a highly poisonous compound obtained from certain plants and trees. It was formerly used as a central nervous system stimulant and can be found in pesticides, commercial baits, and sometimes can be used maliciously to poison pets. Symptoms of strychnine poisoning include limb rigidity, stiff muscles, uncontrolled seizures, breathing difficulties, elevated heart rate, and vomiting and fever. If you suspect that your pet has been poisoned by strychnine, please call your veterinarian immediately. You have 10 minutes to 2 hours. Taking a sample of vomit or feces can help your veterinarian determine the problem. Fertilizer is a very common yard chemical. Eating dirt, grass, or sticks coated in fertilizer can cause drooling, nausea, vomiting, diarrhea, and even death. If you suspect that your pet has ingested fertilizer, contact your veterinarian immediately. Inducing vomiting with hydrogen peroxide is recommended. How can you prevent fertilizer poisoning? It's important to keep all fertilizers locked and in a shed away from your pets, and never allow your pets to play or dig in freshly fertilized yards.
Pentobarbital is a narcotic and sedative barbiturate drug commonly used in the veterinary world for humane euthanasia. How can your pet come in contact with pentobarbital? When a pet is euthanized, owners often choose to bury their pets in their yards and gardens. This can be potentially dangerous to other pets and wildlife who may dig up the body and come into contact with or consume the drug. So, what does pentobarbital poisoning look like? Symptoms often include large blisters, rash, lethargy, unsteady gait, confusion, delirium, difficulty breathing, and coma.
If you think that your animal is experiencing pentobarbital poisoning, take them to a veterinarian immediately. It is important to call your veterinarian on your way so they can have everything set up for your arrival. To prevent pentobarbital poisoning, it's important to not allow your pets to dig in the yard where deceased pets have been buried.